Dr. Evans, thank you for taking my call. I'm ringing about Mr. Mihira, the gentleman with the cerebellar ataxia. His gait has been progressively deteriorating, as you know, with increased truncal instability. We've focused heavily on balance exercises and core strengthening, and while he's made some admirable gains in his static balance, the dynamic aspect remains challenging. However, what's prompted this call is a new symptom. He's now experiencing significant diplopia, particularly when looking to the left. This developed quite suddenly this morning. It's really affecting his ability to track objects and is causing considerable dizziness, impacting his already compromised ambulation.
Diplopia, you say? And sudden onset. Is it constant or intermittent? Any nystagmus accompanying it, MIHIRA?
It's constant, Dr. Evans, and it's a horizontal diplopia. We're also observing a noticeable nystagmus on leftward gaze. It's certainly more pronounced than the subtle gaze-evoked nystagmus he typically exhibits. This new visual disturbance, combined with the exacerbated dizziness, is severely limiting his functional independence. He nearly fell during our therapy session trying to navigate around a chair. My concern is a new lesion or progression affecting the brainstem or cranial nerves.
Diplopia, you say? And sudden onset. Is it constant or intermittent? Any nystagmus accompanying it, MIHIRA?
Yes, MIHIRA, that's a significant change. The sudden onset of constant diplopia with nystagmus in a patient with ataxia immediately raises concerns about a new demyelinating event or possibly a vascular incident. I'll need to see him urgently.
Mihira, I want you to know that what you are seeing right after your baby's cleft lip surgery is almost always perfectly normal and temporary, and it does not mean anything has gone wrong. In the first few days, you will likely notice some mild swelling around the lip and nose, which makes the area look puffy and uneven, but this will go down on its own as healing begins. There might also be a very slight oozing of pinkish fluid or a tiny bit of dried blood along the stitch line, which is just the body's natural way of cleaning the wound. Your little one may sound congested because of swelling inside the nose, and breathing through the nose might feel different for a while, but this passes quickly. It is also common for babies to eat less than usual for a day or two, as their mouths and lips feel sore and unfamiliar, so do not worry if they seem fussy or take smaller feeds. To keep your baby comfortable, doctors recommend age-appropriate pain relief, most often paracetamol in liquid form. You must use the correct dose based on your baby's exact weight, not just their age, and only as your surgical team has advised. Never guess or use adult medicines. Giving this regularly for the first 48 hours helps prevent pain before it gets strong, so your baby can rest, feed a little better, and heal peacefully. You are doing a wonderful job watching over them.